Hi, my name is Brittany Morrow. I work for HealthyBack. I train the MedX equipment for new employees, and today we're going to learn about the lumbar MedX and the cervical MedX. Our HealthyBack physical therapy clinics are different from other physical therapy clinics because of our MedX machine. Our lumbar and cervical MedX machines are unique because it allows our patients to train in an isolated resistance training program because of the restraint systems that are built into each one. On the lumbar MedX machine, we have the femur restraint, we have the pelvis restraint, and we also have the thigh restraint. Together, all three of these work to help isolate the muscles of the low back. By immobilizing a patient's pelvis, we are preventing the contraction of their hamstrings and their gluteal muscles. On our cervical MedX machine, we have the torso restraints, we have shoulder harnesses that come up and over the patient's shoulder, and we have a seatbelt. And together, all three of those work to secure the patient's upper body and isolate the muscles of the cervical spine. Our MedX machines also allow us to test the patient's range of motion and peak torque by performing an isometric test. Each session when a patient comes in, they will be performing a dynamic exercise on the MedX machine through a range of motion that was safely chosen for them and with a selective amount of weight on the weight stack. It has been proven that performing extension exercises results in an increase in strength and improved function in the lumbar and cervical extensor muscles and a decrease in pain levels for chronic back and neck patients. On our lumbar MedX machine, the restraint system consists of the thigh restraint, which comes up and over the patient's legs. He's sitting up against the pelvis restraint, and there's also the femur restraint, which comes up and over the patient's legs. And again, all three of these work together to help stabilize and isolate the muscles of the low back. When tightening the restraints on the lumbar MedX machine, it is very important that the patient is stable enough, but it does not increase any symptoms, numbness, pain, or tingling that they may feel. To tighten the thigh restraint, we use the thigh tighten adjustment until the patient feels snug in the machine. And to tighten the femur restraint, we're going to have the patient set their feet on the footboard, and I'm going to adjust the femur restraint adjustment knob. When the board comes up to the patient's feet, it is very important to ask them to place their feet flat on the board with their toes slightly turned inward. As we tighten the femur restraint, the patient is going to start to feel an increased pressure in their low back. In order to make sure that the patient is secured properly, we ask them to raise their heels slightly off the footboard, and we're looking for less than half of an inch, and we also ask them to reach forward and try to touch their toes. We are looking for minimal movement on the pelvic restraint because this will let us know if the muscles are secure enough in the back to isolate the lumbar spine. Once the patient is secure in the machine, we ask them to have a light grip on the handlebars. We slowly bring the patient into their forward flex position to start the exercise. Once they're in their flex position, we assist them with moving back to the furthest extension point. It is important when the patient is performing this exercise to maintain a cadence of approximately 2 seconds back and 4 seconds forward. Now, the benefits of performing this dynamic exercise is to help increase the strength of those lumbar muscles in the back and to help improve function. Once the patient has completed the required amount of reps, we ask them to finish in the most flexed position. And we take them back to rest. Our cervical MedX machine has a restraint system. We have the shoulder harnesses that come up and over the patient's shoulders. We have a seat belt, which they're going to do up across their lap. And you want to make sure once the shoulder harnesses are on that you ask the patient to pull down on the straps to secure them. Once they are secure, we have the torso restraints, which are going to come up against the patient's chest, and we're going to slowly start to adjust them. To make sure that the patient is secure in the machine, we ask them to try to lift their shoulders. We want minimal movement in this because it will mean that the patient's upper body is secure enough to help us isolate the muscles of the cervical spine. Once the patient is secure in the machine and we want to find their range of motion, I'm going to slowly guide the patient's head back to their furthest extension position and then to their furthest flexion. Each session when the patient comes in, they perform a dynamic exercise on the cervical MedX machine. They will be exercising through their range of motion that was set for them with a selected weight on the weight stack. It is important that they perform this movement at a slow cadence of approximately 2 seconds back and 4 seconds forward. The benefits of this dynamic exercise are to help increase the strength of the cervical extensor muscles along with improving function. When you start the exercise, you want to make sure the patient's head is in the furthest flexed position. And the patient is slowly going to go back for the count of 2 and slowly forward for the count of 4. Once the patient has completed the required amount of reps, you want to ask them to finish in the furthest flexed position.